Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
We all know that losing weight is, well, often seen as this clear path to better health. And, in many ways, it absolutely is.
Right.
But have you ever stopped to think that this very thing we do to get healthier could maybe have a hidden downside?
Yeah.
Especially for our bones as we get older.
It's a really important question. That strength, bone strength, is so vital.
It feels like a delicate balance, doesn't it? How do we manage weight without sort of weakening our skeleton, particularly for women, later in life?
Yeah.
Can we actually do both?
That's exactly what we're digging into today, and it's incredibly relevant, especially now with more focus on weight management in older populations.
Yeah, absolutely.
Because poor bone health, well, it can really impact quality of life. So figuring out how weight loss fits in, it's crucial.
Okay. And for this deep dive, we've got some really interesting material. We're looking at a recent health news article that flags some surprising results.
And as we like to do, we're also going right to the source, the original scientific paper. This one's published in the Journal of the American Medical Association Network Open.
Great. So our mission for the listener today.
Well, we really want to get to the heart of what this research tells us. Can older women, maybe those dealing with metabolic syndrome, lose weight and protect their bones? Is there a lifestyle approach that works?
Lying in that sweet spot, yeah. Improving one thing without harming another.
Exactly.
Okay. Let's get into the study itself then. What were the researchers actually trying to figure out here?
So the main goal was to see how a specific lifestyle program, one designed for weight loss, affected bone mineral density.
That's like how dense and strong the bones are.
Yes. And also the total amount of minerals in the bones, the bone mineral content. Plus, they looked at whether more people developed low bone density during the study. And the key concern really was whether losing weight might actually, accelerate that natural bone weakening that happens with age.
So it wasn't just weight loss, but specifically weight loss versus bone health in older adults.
Got it. How did they set it up? What was the design?
Well, this was what they call a secondary analysis. They used data from a bigger 3-year study called PREDIMED-Plus.
Oh, right. Heard of that one. It was done in Spain.
That's the one. Multi-center, randomized clinical trial. For this specific bone health part, they looked at 924 adults aged 55 to 75.
Okay.
All of whom had metabolic syndrome and were also dealing with overweight or obesity. And it's important to note, about half, roughly 49%, were women.
And these participants were chosen because?
They were from 4 specific study locations that actually had the equipment needed for bone density scanning, the DXA machines.
Right, the dual energy X-ray absorptiometry scans. So what did these folks actually do for 3 years? What were the groups?
They were randomly split. You had the intervention group. They followed a Mediterranean diet, but with reduced calories, about a 30% reduction.
Okay, diet changes. Anything else?
Oh, yeah. Big focus on physical activity, too. They were encouraged to meet the World Health Organization guidelines, so more walking, strength exercises, flexibility, balance work, even some resistance training. Plus, they got behavioral support.
Okay, so diet, exercise, support. What about the other group, the control group?
They also followed a Mediterranean diet, but crucially, it wasn't calorie restricted, and they didn't get specific advice to ramp up their physical activity.
I see. So the real difference is that active calorie cutting and exercise push in one group.
Exactly. That's where they expected to see, or perhaps not see, the differences in bone health.
Makes sense. So one group actively working on weight loss, the other maintaining a generally healthy diet.
Yeah.
How did they track the bone changes?
They used those DXA scans we mentioned, measured bone mineral density in a few key spots, the total femur, that's the thigh bone, the lumbar spine, so the lower back, and a part of the hip called the femoral trochanter, and also the total bone mineral content for the whole body. They took these measurements at the start after 1 year and then again after all 3 years.
And how did they classify bone health? You mentioned low bone density.
They use something called T-scores. It basically compares your bone density to that of a healthy young adult. A low T-score indicates osteopenia, which is weakened bones, or osteoporosis, which is more severe bone loss.
Okay, lots of detail there over 3 years. So the big question, what did they find? What were the results?
Well, it's interesting. When they looked at everyone together, men and women, intervention and control, there wasn't a significant overall difference caused by the intervention in terms of total bone mineral content or the number of people with low bone density.
Oh, So no overall effect.
Not on those specific measures, no. But, and this is where it gets really fascinating, the intervention group, the ones with the calorie reduction and exercise, they showed a statistically significant benefit in the bone mineral density of their lumbar spine, their lower back.
A benefit compared to the control group.
Yes, compared to the control group just eating the standard Mediterranean diet.
And I think I read that this effect wasn't the same for everyone. There was a difference between men and women.
You're absolutely right. That's a really crucial finding. This improvement in lumbar spine bone density was much, much more pronounced in the women in the intervention group.
How much more pronounced? Can we quantify that?
Yeah, they put numbers on it. After the 3 years, women in the intervention group had an improvement in their lumbar spine bone density that was, on average, 1.8 grams per square centimeter greater than the women in the control group. That's quite substantial.
Wow, okay. And for men?
Interestingly, no significant differences were seen between the men in the intervention group and the men in the control group for any of the bone density measures.
That's a very clear sex-specific result then. Were the researchers confident in this finding for women? Did they double-check it?
They did. They ran several different types of analyses to make sure the results were robust. They looked at the data, including people who dropped out. They looked only at those who finished. And the finding held up that improvement in lumbar spine bone density for women in the intervention group was consistent.
Any other interesting checks?
Yes. They also did an analysis focusing specifically on women who weren't taking calcium or vitamin D supplements.
Oh, okay. To remove that potential influence.
Exactly. And even in that subgroup, they still saw the significant benefit in the lumbar spine for the intervention group. And what's more, in that specific group of women not taking supplements, they also found a significant increase in total bone mineral content in the intervention group compared to controls.
Wow. So this really seems like potentially good news then for older women with metabolic syndrome who might be thinking about losing weight, especially regarding their spine.
It certainly points that way. The broader implication is that this kind of combined lifestyle approach, the reduced-calorie Mediterranean diet plus increased physical activity, it might be a feasible way to actually lessen that age-related bone density decline in the lower back, even while weight is being lost.
And that's huge because low bone density is directly linked to fracture risk, right?
Absolutely. Maintaining bone density is crucial for preventing fractures, maintaining independence, and just having a good quality of life as we get older.
It also makes you think about how people lose weight. Because haven't some studies shown weight loss can sometimes be bad for bones?
That's a really important contrast to draw. Yes, some previous research, particularly looking at weight loss achieved mainly through dieting without specific exercise, has shown it can lead to bone loss.
So the combination here might be the key.
It strongly suggests that yes, the combination of the diet and the specific physical activity recommendations might be what offers protection, particularly for women in this study.
And what about the diet itself? The Mediterranean diet is pretty healthy, even without cutting calories. Did that play a role?
That's a fair point. Even the control group was eating a healthy, generally bone-protective diet. So it seems the added benefit in the intervention group, especially for women's spines, likely came from the synergy of cutting calories and significantly boosting physical activity, not just the diet type alone.
Okay, that makes sense. Now, no study is perfect. We always need to talk about limitations. What should we keep in mind here?
Definitely. A few things. First, remember this analysis used a subset of the PREDIMED-Plus participants, only those who had the DXA scans.
So maybe not perfectly representative of the whole group.
Well, they were generally similar, but it's still a subset. Second, generalizability. These were older adults in Spain with metabolic syndrome and overweight or obesity. The results might be most applicable to similar populations. We need to be a bit cautious applying them directly to, say, younger people or those without metabolic syndrome.
Right. What else? Did everyone stick with it for the full 3 years?
Not everyone, no. There was some loss to follow-up, which is pretty normal for long studies, but as we mentioned, they used statistical methods designed to account for that and minimize potential bias.
Okay. And the positive effect was strongest in the spine. What about other areas?
That's another point. While the lumbar spine results were significant, the effects weren't as clear-cut elsewhere, like the total femur. Also, there's a technical consideration. Sometimes, as people age, calcium deposits can build up in the spine area, and that could potentially influence the DXA readings there.
Ah, okay, a measurement consideration. And did they track actual broken bones, fractures?
No, that's an important distinction. They measured bone mineral density, which is a major risk factor for fractures, but they didn't track fracture rates. We'd need longer studies specifically designed to look at fracture outcomes to confirm if this intervention truly reduces them.
And one last thing you mentioned earlier, the specific part of the hip most prone to fracture, the femoral neck.
Right. The DXA scans in this study didn't provide separate data for the femoral neck specifically. They did analyze the total femur, which includes that region, but not the neck in isolation, which is a critical site for hip fractures.
Okay, that gives us a really good picture of the study, the findings, the nuances, the caveats. What are other experts saying about this? Does it fit with the broader understanding?
Generally, yes. Experts acknowledge that link. Weight loss can sometimes lead to bone loss and potentially increase fracture risk. It's a known concern.
And the exercise part?
There's agreement that exercise is good, but the optimal type for protecting bones during weight loss is still, well, under investigation. Some research points towards resistance exercise being particularly beneficial, which was encouraged in this study's intervention group.
How does this PREDIMED-Plus analysis stack up against other big trials?
It's interesting to compare it to, say, the Look Ahead trial. That one focused on people with type 2 diabetes and used a low-fat diet intervention.
And what did they find regarding bones?
Look Ahead actually reported some bone loss in their intervention group. So, seeing a benefit in the lumbar spine in this PREDIMED-Plus analysis, particularly in women, suggests that maybe the Mediterranean diet combined with this specific activity plan could have advantages for this population, older adults with metabolic syndrome.
That's a really key comparison. And the fact that women benefited more. Any theories why?
Experts suggest a few possibilities. Women might just have different bone density levels in the spine to begin with compared to men. They might also be more sensitive to bone changes related to having excess weight.
And hormones, presumably.
Absolutely. Menopause and the associated hormonal shifts play a huge role in women's bone density. That's a major factor.
Anything else?
Well, there's also the idea that the Mediterranean diet itself is considered more anti-inflammatory and potentially more bone protective than other dietary patterns. And it's possible, though not measured directly, that women in the study might have adhered more closely to the diet recommendations. Lots of potential factors.
Okay, so let's try and boil this down. What's the main takeaway message for our listeners, especially maybe older women who are thinking about managing their weight?
I think the most important message is one of hope, really. This research suggests that a well-rounded approach works, combining a healthy diet, potentially with reduced calories like the Mediterranean style used here, with regular physical activity, walking, strength, balance, flexibility could be a really effective strategy.
A strategy to potentially slow down that bone density loss, especially in the spine, even while losing weight.
Exactly. It suggests you might be able to achieve both goals simultaneously with the right approach.
It really highlights that how you lose weight could be just as crucial as the weight loss itself for bone health. So if someone's listening and thinking about this, what's a practical first step?
Well, I'd encourage thinking about integrating both elements: healthy eating patterns like the Mediterranean diet and consistent physical activity. Maybe start small. What's one change you could explore? Adding a daily walk, trying some simple strength exercises a couple of times a week, shifting some food choices.
And critically, who should they talk to for personalized advice?
Oh, absolutely. The most vital step is always to discuss this with your own doctor or healthcare provider, especially if you're an older woman, perhaps with metabolic syndrome, considering weight loss. They know your individual health picture.
They can help tailor an approach that's safe and effective for you.
Precisely. And you could even ask them about PREDIMED-Plus if you want to know more about the specific lifestyle program they used.
So it's valuable insight, a reminder that health as we age isn't just about one single thing like weight. It's about that comprehensive care.
Exactly right. This study offers a hopeful perspective on navigating weight and bone health complexities later in life, especially for women. It really underscores the power of a holistic lifestyle approach.
Yeah.
And maybe here's something to think about after we finish. We see this combined diet and exercise approach potentially benefiting bone health during weight loss. What other aspects of your health do you think might get a similar boost from tackling diet and activity together? It makes you wonder how interconnected it all really is, doesn't it?
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.